Sir, we are live now. With all your permission, I am starting this webinar for today.
Yes, please go
Good
ahead.
evening, everyone present here. I am Faraz from IGCP Group. Welcome all the audience for today's session. On today's panel discussion on heat stroke in all age groups. Before starting this session, let me tell you overview of the topic. The discussion is on heat stroke is a potential life-threatening condition that can affect individuals of all age when their body temperature rises to dangerous level due to prolonged exposure to high temperatures. Strokes can lead to several complications including organ damage, even death, if not promptly treated. Recognizing the early signs such as high body temperature, altered mental state, and rapid pulse is a crucial for swift interventions and preventing adverse outcome. So on today's session, the discussion will be carried. There will be our panelist and there is moderator also for today's session. Before starting this session, I would like to invite moderator for this session, Dr. Vijay Varat sir, and let me share some of the achievement of sir. Sir has done MBBS and he is MD in consultant allergist, pediatric pulmonologist, clinical immunologist, and consultant at Sai Allergy Asthma Eye Hospital, Shaidri Hospital, Imamdar Multi-Speciality Hospital. By taking not much time, I would like to invite sir and hand over this session to sir. Over to you, sir. Kindly proceed from here.
Thanks for us for the introduction, and thanks to IGCP for giving a platform for a very important topic, and which will be really discussed. So lucky that today I have one of the best faculties while discussing panelists for today's session. So I will just share about their credentials and the thing. So Faraz, are you sharing the thing? Yeah. Okay. So first panelist, I would like to welcome Dr. Vijayalakshmi Madam. While having a talk, she said this is a very old slide, but still we have this. Professor Emeritus, former HOD of Pediatric Cardiology at Sri Jaydev Institute of Cardiovascular Sciences and Research, skilled interventionalist, pioneer in pediatric cardiology, President Indian Academy of Echocardiography, brilliant academic career, 39 gold medals, proposed the ECHO criteria for the early and precise diagnosis of carditis in acute rheumatic fever and national policy for congenital heart disease. Best presentation award at PICS at Chicago and Boston. First prize for outstanding scientific presentation at World Congress of Echocardiography. Has received many prestigious awards for her academic and literary work. She has 52 publications, 105 research papers, 32 international, so on her own credit. Delivered 210 scientific lectures, authored step by step to ECHO in CSD and dated monogram on ARF and RHD. So please, I welcome ma'am for the today's session.
Thank you.
Another is a very eminent personality, Dr. Vinay Goyal from panelist, Chairman, Neurology Institute of Neurosciences, Medanta, Gurgaon from Delhi, post completing his DM Neurology from AIMS in Delhi in 1999. He joined his prestigious alma mater, AIMS, New Delhi, in the year 1999 in the Department of Neurology as a senior resident and rose to the level of professor before joining the Medanta family. He has various publications, articles, chapters published in both national and international papers and journals. Dr. Goyal has won several awards, including IMA Academy of Medical Specialty Distinguished Service Award. So I welcome Goyal sir also.
Good afternoon.
Good afternoon. And third panelist is Dr. Kumar Prafulla Chandra, Director at the Department of Internal Medicine, Diabetes Care, LCT, Vistar Hospital, Gomti Nagar, Lucknow. He's from Lucknow. And he has multiple fellowships in Indian College of Physicians, Eurasia Academy of Clinical Diabetology, Netherlands, Indian Society of Hypertension, Uttar Pradesh Diabetic Association, Indian Society of Chronomedicine, Research Trust of Diabetes India, International Society of Medical Nutrition, Indian Academy of Clinical Medicine, and previous positions like Senior Scientist, Department of Drug Discovery, Torrent Research Center, Gandhinagar, more than 25 publications, including the original research book chapters, patent and review articles. So welcome, Kumar sir.
Thank you, sir.
And so today, we'll go to the today's discussion. Can you give me the permission to share my screen?
Yes, sir. It is there, sir. You can share them.
Yeah, sure. So just as I started with the thing, and in Pune, I am associated with one of the environmental, and from the different faculties, we are all there as a scientist, botanist, neurobiologist, from the Pune University also, from the Pune Municipal Corporation, politicians also. And we always care about the environment, all of us. So one of my friend just recently, he sent me environmentalist from the Bharatiya Hospital of Environmental Sciences. He's the head of the department also. And you can see like how the scenario is changing and how the environment is boiling, we can say. And definitely it will have an impact to the community. And a lot of the diseases and direct and indirect effect to the, even it has been seen that when the environment changes, the global warming changes, the pollution also increases in dust particles, and the potency of the pollens also increase. The extended pollens we are seeing previously, never in summer we used to see cases of asthma or rhinoconjunctivitis, but this season it's full of rhinoconjunctivitis and even skin allergies and all. So considering all these things, we'll discuss from the very well-known panelist about the how this heat stroke, which causes a lot of problems. And first, what is a heat stroke? Dr. Chandra sir, can you enlighten on that?
Okay, see, let me tell you, our body tries to maintain a constant temperature through losing heat continuously. And the loss of heat occurs mostly by conduction or evaporation. So when the environmental temperature is less than body, then the air which comes in contact of our body through conduction, heat loss is there. And mostly this account for the heat loss when temperature is lower. However, when temperature starts rising, evaporation starts taking role in that. So when temperature rises further, sweating occurs and water evaporates from the body temperature, body surface, and the latent heat in evaporation of the sweat or water leads to cooling of the body. What happens then when there is imbalance, or the atmospheric temperature is very much high, and when the cooling system of our body gets compensated, the body temperature starts rising. And when the core temperature of the body is more than 40 degrees C, at that point of time, the sweat gland or sweating stops. So in heat stroke, the cooling mechanism of the body gets compromised, sweating stops, body becomes red and hot, core temperature is more than 40, which ultimately leads to problems in different organs. So person will have, headache, dizziness, person will have altered sensorium, nausea, vomiting, and as such, in heat stroke, pulse would be, high volume pulse, there will be throbbing headache. So whenever there is exposure to heat and cooling mechanism of the body gets decompensated, body becomes red and hot, core temperature is more than 40, we define that as heat stroke. Thank you, sir.
Thank you, sir. So as a physician, you must be seeing all different type of presentations. So Goyal sir, like as a neurologist, you must be seeing a lot of all these complications of neurology because of the heat stroke. Can you please enlighten on that? Dr.
Sir,
Goyal,
please unmute, sir. Sir, unmute your, okay.
Yeah. So first of all, we have to understand what is the main symptoms when you can understand one should diagnose as the heat stroke. The most important thing, as was discussed just now, is body core temperature. When it rises above 40 degrees, then one should suspect, is it a heat stroke? Because of that, there is an all hemodynamic disturbances. Patient may develop hypotension, high fever, tachycardia, and with that, there is an altered mentation, which patient could be confused, agitated. There may be change in the speech. He may look delirious, and sometimes they may have seizures, and ultimately they may lead into the coma.
As we just learned that there is a decreased sweating, so skin will be dry, but that depends whether the heat stroke is because of the external exposure or because of the internal metabolic state. So usually skin is dry and it's not sweating, so it cannot evaporate the body heat. That's where situation patient will have a heat stroke. There may be associated nausea, vomiting, flushed skin, red color skin, and tachycardia, tachypnea. These are some of the symptoms, and patient may have associated headache. If these are the symptoms, then one should suspect is this situation. But the most important thing is the exposure to heat. I'm sitting in an air-conditioned environment, I may have all these symptoms. I will not call it a heat stroke. So it is exposure to heat. That is the first and foremost situation where somebody would develop a heat stroke.
Thank you, sir. So, Vijayalakshmi ma'am, like what happens to the body as a result of exposure to the extreme heat in children?
Thank you very much. Whatever happens to the body is not just after birth. Even before the birth in the fetus, it can affect. If a pregnant woman is exposed to the extreme heat and she has the heat stress, and that heat is transmitted to the fetus, and what happens is there is a shock protein development due to the heat, and this is an teratogenic, and that can cause a congenital heart disease in the to-be born baby, especially if this heat stress occurs in the first trimester. And apart from that, what is important is in the infants and the children, especially the premature ones, they don't have the properly developed sweat glands or the other organs. So because of this immaturity and then their immune mechanism itself is low, there is a problem. And apart from this, what is important is in children, their activities are much more than the adult, and inside there is the internal energy or the internal heat that is generated due to their activity. It is much more than the adults. And apart from that, if you take the body surface area and the body mass index, in fact, in children, it is much more. And as a result, when they play in the playground with the hot sun, they absorb much more heat compared to the others. So absorbing the heat from outside is much more in the children compared to the adult. And as a result, right from intrauterine life to the newborn babies to the young children, they are more vulnerable to the alteration because their heat mechanism maintenance is not as well developed as the young adults. So as a result, causing the dehydration or the problem is much more. And in fact, I would like to quote before the Vedas in the Narayan Sutta, it is described about the heart. The heart is the one which maintains the temperature from head to toe. And everybody thinks that it is only the brain that is affected, but this heat temperature maintenance is by the heart, because the blood has to be pumped to each organ and every nook and corner of the body. And when the dehydration occurs because of the sweating or excessive heat, and at that time there is a strain on the heart, and that results in the tachycardia and all the problems. And hence, the children are much more affected compared to the young adults.
Thank you, ma'am. And even I think our mothers are more smarter. I remember in still my childhood. So whenever in the summer, suppose the head and the hands and feet is to be more warm, our mothers never used to allow us to go to the sunlight. And even many of the mothers, they will
Correct.
complain about these things.
So
Yes.
that is called as wisdom. So
Yes.
what we have is the book information, bookish knowledge, but then our parents and grandparents, they had a better knowledge about tackling the problems in the heat. And in fact, just 2 weeks back, I was in Ayodhya. There was not only the heat storm, and it was even the dust storm was there. And then I went to Chandigarh there also. In fact, we were cursing in Bangalore why it is so hot. But when I went there, I thought Bangalore is like a heaven. So we are much better off. So it is always, better
Yes.
to get adjusted to the surrounding rather than blame the surrounding.
Yes, ma'am. Thank you, ma'am. So, Chandra sir, like as you already said about how the heat increases and the more than 40 degrees, how it happens. And so, like anything you want to add, like what happens to the different organs and uh, because of this extreme heat?
See, the way exposure to heat happens, first of all, there is excessive sweating, and certainly that leads to decrease in the blood volume, or the body gets dehydrated. And as explained by madam, the blood supply, the heart starts getting less blood volume, then tachycardias would happen. The another important aspect is that when blood flow or cardiac output is decreased, blood flow to other vital organs starts decreasing. So there is risk of injury to kidney because of decreased renal perfusion. There is risk of injury to liver, and another most important organ which often gets damaged is lung, because of 2-3 ways. One is, of course, decrease in the blood flow. Then hot air, you breathe in and breathe out hot air. So at times, injury occurs to the lung parenchyma, and people develop acute respiratory distress syndrome also. Another thing that may happen during heat exhaustion or heat stroke is usually muscles get damaged. And due to damage in the muscle, often, kidney also gets compromised because of the myoglobinurias and others. At times, due to damage in the muscle, even, swelling in the muscle occurs, and compartment syndromes may also occur. Electrolyte imbalance associated with heat exhaustion and heat cramps may lead to cardiac arrhythmias also. Nowadays, we often see reports that during hot, humid climate, people are, doing a lot of exercise in gym, and at times their core body temperature rises, and electrolyte imbalance occur, which include hyponatremias, hypokalemias, and hypomagnesiemias. And in them, usually cardiac arrhythmias do occur, and we often see that there is cardiac arrest during the exercise. So all these complications related to different organ may occur during heat stroke or heat exhaustion. Not to forget the CNS complications, as told by sir also, that yes, the perfusion, when the core body temperature increases to more than 40 degrees, then altered sensorium, seizures. These are other complications which may occur when we talk about CNS. So almost all organ may get affected some way or the other in heat stroke. Thank you, sir.
Thank you. So as you talked about CNS, so Dr. Goyal sir, like what are the complications and the people come to you like because of the extreme heat?
Sir, please unmute yourself, sir.
Most of the time they land up too early because they lose consciousness. And when they lose consciousness, that may be because of a lot of reasons, especially when there is a hypotension, there is a cerebral hypoperfusion, they may have seizures, and that leads to more complications. But with that, as Dr. was just now telling, that it can affect even multi-organ failure. So it can lead to hepatic involvement, it can lead to renal failure. So, classical heat stroke can be divided into 3 stages. First is a hyperthermic state, which is first 24 hours, where you may have associated neurological complication like delirium or autosensory. Then second stage, which peaks around 24 hours to 96 hours, is called hematologic or enzymatic phase, where you get all these, including interventricular hemolysis and their liver enzymes increasing, develop. And third is the later stage, which is called late renal or hepatic phase, or hepatic renal syndrome, which start usually about 96 to 100 hours after this, if this is not treated well. That lead to multi-organ failure and all the complications we understand. But most of the time, they'll end up in neurology or ICU ward because they have an altered sensorium. So this is the neurological complication which happens in patients with heat stroke.
Ma'am, like in children's, like what do you, I mean, anything added to this?
Yes, I'm not
In
a
fact,
pediatrician. Ma'am will help us in that.
yeah. Of course, Dr. Goel mentioned everything. And only if the mother in the first trimester, if she is exposed, the child can have a spina bifida, the other neurological problems when it is born. So that is one thing that many people are not aware of it. So not only the congenital heart disease, even the neurological defects can occur for the fetus. And in the infants and other children, it is almost like whatever Dr. Chandra has told, but one difference is, unlike the adults, they will not be profuse sweating because the sweat glands are not yet matured and they are not able to produce more sweat. And as a result, the maintaining the body temperature, like sweating is very important for throwing away or taking away the temperature from the body and making the body cool. See, in adults, when they sweat, they become cool and then they become quite nice. But in children, they remain very hot. And there, especially infants, you will have to take the rectal temperature. Otherwise, you will not be knowing how much temperature has gone up. And in fact, the temperature is much more because they are unable to dissipate the temperature. And apart from this, what happens is there will be, though the child has got emergency, the child is not able to talk or tell that it is tired or something. It becomes listless and it's not able to express. It becomes irritable and crying. And the more it cries, the worse it is because again, the energy is much more. And this is how it becomes a vicious cycle. At least the adults, they'll feel thirsty and they'll drink water. Whereas the child cannot, if the infants cannot take up that. And as a result, the dehydration is much more profound and the body temperature cannot be controlled on its own. And they require assistance from either the parents or the doctors or the nurses because they cannot control on their own. And with adults, they will wash their face with the cold water and then they pour water and have a cold shower. But the children will not be able to do that. So we have to assist the children. And that's how we know in children, depending on the body weight, the children, they are much more prone, and especially the lower the body weight, the worse the prognosis is. So, Dr. Chandra told about the cardiac arrest. That is all because of the electrolyte imbalance. In fact, we say that whenever the adults are exposed to the cold, they have the coronary spasm and they get the heart attack. But when they're exposed to the heat, they are more prone for the cardiac arrest, not the heart attack. So that's how these are the things. And especially in the post-corona era, people won't know whether it is due to the sudden cardiac arrest is due to the corona, post-corona, or something else, or the drugs, or as you mentioned in the, the gym, and in the gym also they drink the formula and other things. And there also the sudden deaths are known to occur. But in children, invariably it is playing in the ground, that too in the hot sun, that makes. So I remember as children, whenever we used to go for the games, our teacher used to give the limbu with the salt on that and then choose it and then drink water. But now they have the sports drinks and other things are all available. Electrolytes are there and lots of things are there. But still, the children need more assistance compared to the adults, and they require early intervention compared to the adults.
Thank you, ma'am. So, Goel sir, who is at the greatest risk for heat-related illnesses?
Sorry?
Who is at the greatest risk for heat-related illnesses?
The biggest risk factor is, like ma'am is mentioning, children and extremes of age. So children whose metabolism is different, their surface area is different than their mass, and elderly people who cannot compensate. Other are, especially if you are in extremely hot weather. So environment is another risk factor for this. Third is sudden exposure, like you are in an air-conditioned environment, and if you have a higher heat exposure immediately after that, that may be also a factor that can lead to heat stroke. Then lack of air conditioning, what ma'am is mentioning is the people who go to gym, they are exercising extensively, but the sometimes gyms are not well ventilated. So that is another reason they get an exhaustion, what is the external exposure, and they can lead to heat stroke. Other thing is, I think clothes are also equally important. In summer, we all wear cotton clothes because it can absorb the sweat and allow the air to pass through the clothes and allow the body to cool down. The youngster who wear more fancy and jazzy clothes, which are mainly of polyester, and they don't allow the air to pass through the clothes, and body heating is more common. And when they are playing in hot environment, that is one risk factor. Other one factor is hydration. In childhood also, we were asked to drink a lot of water before you go out of the house.
Correct.
So this was a kind of a preventive measure, and all sports person you see, when, especially if you see long distance run, they keep drinking water or electrolyte and also
Or pouring water on themselves.
Yes, that is a very nice mechanism that they want to cool down themselves. So these are some of the risk factors, and other is environment, this industrial exposure. Sometimes the industrial exposure, they may not be all air conditioned and they may not be have a temperature control. If you're going to what you call it, iron furnace, where they make these girders and wires and pillars out of, the temperature of that area near the furnace should be around more than 2000 degrees centigrade.
Correct.
Even if you are at least 20 feet away from it, you can feel a severe heat. So the people there, sometimes they wet themselves before go to that environment, so that they don't get exposed to the extremes of heat, and keep drinking a lot of water. So these are the factors. So bottom line is, whenever there is a high heat exposure, that is one risk factor. So when I was, because I studied in Rajasthan, so in Udaipur Medical College, we used to see patients with heat stroke, but you don't see them in Delhi. It is more common in Bikaner, Badmer, Jaisalmer, and extremes of weather conditions where the temperature go above degrees centigrade in time.
Yes, sir. Thank you, sir. Even like as an allergist, I have seen nowadays a lot of cases of these cholinergic severe urticaria and some of the patients with cholinergic anaphylaxis also. So if they get suddenly exposure to the heat while playing outside and all, younger children I have seen, more than 18 patients I have, and they used to have us after exposure to the sun and after exercise, they get a severe urticaria with angioedema and may require even emergency medications also. So such type of patient to patient, the sensitivity and the scenarios are changing. So Chandra sir, like, what are the warning signs of heat stroke, like for the doctors also in their practice and for the community also, how they can identify and what awareness we can make it?
Okay, couple of things I wanted to add in the previous topic
Yes,
also.
please. Yes,
Rightly said, Vijayalakshmi ma'am had told that yes, heart is an organ and proper perfusion is really necessary. And for heat loss, cutaneous perfusion has to be maintained so that
Exactly.
heat loss occurs from the skin. So if a person has got heart failure or compromised heart, or if a person is obese, so these are the other group of person who are at higher risk of developing heat stroke. And then, yes, rightly said by Goel sir, that unusual exposure, if preconditioning is not done. I mean, I am used to playing for 1 hour, and if I play for 3 hours directly in the hot, or if I'm used to working under shade, and if a laborer starts working in sun for longer duration without adequate hydration, so these are the risk factors which occurs. So what I wish to add in the answer to the current question, what are the warning signs? These are really very, very important to be identified. Also for the management of heat stroke. Whenever we talk, how can you prevent heat stroke? The first thing that we wish to say that we should be able to identify the warning signs. Recognize heat stroke early. So what it would be? Heat stroke does not come at once. It will come stepwise. First of all, heat exhaustion will occur. So during heat exhaustion, earlier stage, there will be profuse sweating. Person will start feeling fatigueness, weakness. I mean, the skin will be too much watery. So these are the early signs. Weakness will be there. Fainting may occur. So these are the things that begin with in exposure to heat. And rightly said that, I mean, children, their parents, caregiver, athletic trainer, they also know about these warning signs early so that the person does not progresses to heat stroke level. Many times we see our kids coming back from school and they are red hot and their skin is dry. We often say that just he has come from sun and that's why he is. Let us recognize these things early. Even school teachers should know that if a kid is having dry red skin and hot, he is probably going in heat stroke. So if we identify heat stroke early, see these warning signs early, pulse is very much rapid, pulse is bounding, person is getting restless. So these are the warning signs which should be identified early, and prompt management should be done so that it does not progresses to frank heat stroke where all those complications may occur. Thank you, sir.
Thank you. Vijayalakshmi ma'am, like in children's, you want to add something?
Yeah. In fact, they said who all suffer much more. In fact, the children with heart disease, they suffer much more the heart stress compared to the normal heart, because their adaptability is much less and the cardiac output is also much less. And in children, the warning symptoms or signs are mainly the headache. But if the child is very small, the child may not tell about the headache, and grown-up child may tell about the headache. The nausea, dizziness, and the weakness. Most often, many parents, as Dr. Chandra said, they mistake the red face as because of the child has played in the playground. But in fact, that is a sign to tell that the child is not sweating, but there is a redness of the face with the dry skin. That means the child is going for the heat stress. And this heat stress, it is usually associated with the muscle cramps. And in children of also adults also, muscle cramps are much more. And these cramps are because of the electrolyte imbalance and also because of the rhabdomyolysis. And because of that, the child may have the severe cramp. And then most of the parents will think that, oh, child has played and there must be some sprain or something. And that sort of wrong diagnosis or the misinterpretation should not be done by the parents. The first thing that they have to do is make the child drink water. The water is most important here to maintain the hydration and also to bring down the cooling effect of the body. And here, instead of ice cold water, giving the normal water is very important, because ice cold water is also injurious to health, and that causes the vasoconstriction in the stomach villi. And as a result, the normal water should be given. In fact, Dr. Vijay, I would like to tell about the water. In fact, in the Atharva Veda, the water is called as the elixir of life. It is like the greatest balm which heals all the cells in the body. And whatever the enzyme, the reactions are occurring in the 60 trillion reactions occurring in the cells, they require water. Not only the oxygen and also water and nutrition, all the three are important. So oxygen, nutrition, water is supplied by the pumping of the heart. And for that, we have to see that as the child goes out, make the child drink water and go out, and give the water, not the plastic bottle water, give it in the copper or in the steel bottle, enough water. And you can add either cucumber or menthol leaves or lemon in that, so that the child can easily drink. And when the child comes back, also give the drink. And apart from that, with the cold mop, make the child have the cold water shower. Many people think that cold shower the child may get infection. No, it is not get the cold. In fact, the body becomes cold means the child will feel much better. And here you mentioned about the asthma. I would like to tell you, whenever the heat is more, there are dust storms are created. And this dust storms, along with the pollen, the allergic tendency also will be more. And that's why, in children, we have to take extra care and never put them on the dark clothes or something. In fact, white or the lighter clothes, loose clothes, cotton clothes must be put to the children during the summer, and especially when they go for the play. And once they come back, ask them to wash the face with the cold water and splash the water, and then see that the sweat and everything is dust is removed, and blowing the nose and making them clean. And that is very, very important.
Thank you, ma'am. And as you rightly said, the white clothes and all. So I still remember recently I had been to the rural area and I found most of the people wearing white clothes and they had all the covering, those long clothes. Like
Only
they have
eyes
called,
are left. Only eyes are left.
yes, ma'am. So this is called gamcha into the rural area. And so they used to have completely like caps, white caps and all. So they are more like with the experience they have learned these things, and that's why the old people always their
That's the wisdom. That's the wisdom.
that's the wisdom of clinical experience, we can say.
Yeah.
And at the name of the fashions in the urban areas and all, people are getting suffered. I mean, because they're not taking that precautions. And even we remember like when we used to watch a cricket previously, the cricket players also used to have all white clothes, white caps and all.
Yes, correct.
Yes.
They
Yeah.
always played with the white. And the
Yes.
color has come with the IPL and all other things.
So, that's really, thank you, ma'am. So, Chandra sir, what should patients or relatives do if see someone with any of the warning signs of heat stroke? Initially, immediately, what should do they before reaching to the hospital or clinic?
I think the first and foremost is, as we know, this situation will arise when the temperature is high, like now Delhi temperature is touching almost 40 degrees centigrade. And unfortunately, school timings are still up to 2 or 3 o'clock. So when they are returning in the evening time, they have a huge heat exposure. And around 11, 12 o'clock, when there is this recess or sports time, again, it's in high temperature area. So we have to educate them that they have to avoid heat exposure as much as possible. Drink a lot of water, which fortunately children carry, and all the schools have now adequate facility for drinking water. One may also do it, put some electoral powder or, like ma'am was telling, Nibu Pani in their bottle. So that contains electrolyte, which will compensate when they go out. When they are back home, they may have a lot of fruits which contain minerals and water and calorie as well as. So right now there are a lot of good fruits which are water rich and good full of electrolytes. So that should help these children as well as adults to get rid of this heat issue.
Thank you, sir. So anyone wants to add anything? Please.
Yeah, I would like to add to Dr. Goyal's thing. He told do's. I would like to tell don'ts. He said lots of water, carry the water, that is fine. Don'ts are, don't allow the children to drink the aerated drinks or the, canned this thing which contains high sugar. And the more sugar they take, the worse it is going to be. And that is going to add up to their metabolic syndrome in the later period. And what they require is the oxygen. And when they take the carbon dioxide, it's going to be deleterious. And that's the reason, tell the children not to drink ice cold water from the fridge, not to drink this aerated drinks, not to drink these drinks like Maaza and other things which contain sugar syrup. Instead of that, tender coconut water or ice thanda or buttermilk and water. These are extremely good for health, and that's what the children must be taught the right habits.
What ma'am mentioned, also avoid energy drinks, ma'am, which contain large amount of caffeine.
Yes, sir. Yes.
Because
And the caffeine is going to add up to the tachycardia and also going to be carcinogen. And
Yes,
as a result, the energy drinks must be avoided. And the parents should be very, very careful, especially the mothers. They must be strict and they must teach the children what is right and what is wrong. And that is the bounden duty of every mother and every pediatrician and every doctor.
yes.
Thank you. Chandra sir, will you like to add anything? Yes.
Yeah, so if I was to, put the things in a very short perspective, I would say stop the exposure to hot environment is number one. Number two, bring the person to cool temperature. Number three, stop the activity which was causing rise in the body temperature or was causing heat production within the body. And number three, different type of rehydration along with electrolyte. So these are the three things has to be done. Stop exposure, bring to cool environment, stop the activity which was causing heat production in body, and do adequate fluid and electrolyte replenishment. This is what patient or relative should do immediately when there are warning signs. Thank you, sir.
Thank you,
In
sir.
a lighter vein, I would like to add something. All
Yes.
the time we are discussing about how to bring down the temperature of the body, but how to bring down the temperature of the surrounding environment, it's a very anecdotal one. I went for the convocation of Koppal Medical College, and it was 5:30, 6:30, and they're not starting. Everything is ready, but they are not starting. And then I asked, why are you delaying when the chief guest is there? Everybody is there. Why are you delaying? They said, no, we are waiting for the temperature to come down and the cool down, and then we would like to start the program. And then I said, the best way to bring down the temperature is the rains. And then he said, no, madam, it doesn't rain at all. I said, sir, wherever I go, it rains. And you just wait and see. I just said it jokingly, and within 10 minutes, it started raining. It is not raining, it was pouring. And along with the thunderstorm, and all the lights and the stage came down, that the chair started flying. And what is worse is, about 6 to 8 doctors, they fell flat. The wind energy is so much. So wind is the one which takes away the heat. The water is, the rain is another thing which cools down. And the best thing is to avoid all this anarchy or environmental chaos, is to grow the plants as much as possible. So cutting the trees should be stopped and growing the trees must be done, so that the whole earth becomes cool and the global warming comes down.
Ma'am,
Thank
Delhi is rising. You are invited to Delhi once in a week.
That is what I was also saying. Please do come to Lucknow. Yes, we have not got rain.
It's a-
December,
in 3
I'm
months.
coming to Lucknow.
Yes,
It's a
no.
lighter, but it is a very serious mode also, I can say. Because
Sir,
that is the only thing long-term wise, that is only going to, help our new generation and the next generation. Rest of the other doctors, we are all treating the patients. But
Yes.
the environment is I will say that is the bigger, doctor. And he will only take care of all of us. And
Dr.
already
Goel,
while
in fact, in this is 1998, May 31st, I remember, I was sent to Escorts, and your boss was the chairman there, and he had
Thank
arranged
God.
for my stay and everything, and
Yes.
great respect for him. And what happened was, I went literally crying because the Bangalore temperature was so nice, and there it was 44 degrees. And I used
Yes.
to take a wet cloth on my head and put the air cooler and everything and start reading from the fetal circulation. But on the way, in the flight, I met two people. One was the Captain Kariappa, who was going to the Siachen, which is temperature is very, very low. This
-50.
is soon after the Pokhran explosion,
Yes.
and then I realized that I wanted to go to Manasarovar, and I was sent for the pediatric cardiology training. And after 1 week, I came to know that all the 33 people who went to Manasarovar, they died in the landslide because there was a heavy rain there. So here, sunstroke, and there, heavy rains. And then I survived. So that's the reason, I said that we have to give respect to the nature.
Yes. Thank you, ma'am. So, Goel sir, nowadays we see a lot of patients with the leg cramps and during the summer and so what are
rashes,
these
and
deep
rashes also.
Yes, ma'am. So who are these people which are really affected because of that?
Actually, who will have cramp is not a very straightforward answer. A lot of people have a tendency to have cramps. And these are the people who have, especially those who sweat more. So they have more electrolyte imbalance. And in summers, they sweat more. Especially, you will see a lot of people who get cramps in the night while they are sleeping. This incidence increases during summertime because there is a more electrolyte imbalance. The muscle has a different potassium level, and that's where it leads to muscle cramps.
Correct.
So it is as simple as to hydrate themselves and take a lot of electrolytes. That is a simple answer to them.
Thank
And
you.
eat lots of citrus fruits also.
Yes, ma'am.
I have never had any cramps. That's because I eat citrus fruits every day. Start the day with the fruits and the limbo juice. And another thing is, whenever the rashes occur, it is usually in the neck or in the elbow region. And these are very tiny papules or like macule-like things. And many people, they start putting powder. And when they put powder, they close the pores. The sebaceous glands as well as the sweat glands, the pore will be closed. And as a result, that should not be done. Even applying cream should not be done. In fact, applying the sunscreen is okay, but applying any cream or powder to these rashes, that is because of the heat, should be avoided. Instead of that, with the wet cloth, clean it and as much as possible, cool it down rather than putting powder.
Yes, ma'am. Absolutely, as you said. Because as an allergist, I get a lot of eczema patients during these adult
Correct.
season because of the weather
Absolutely.
change and the sweating that triggers the things. And
Absolutely.
again, we have seen that many of the people, when they are in the AC for a minute, much time, and then they suddenly expose.
Suddenly
These
exposed, yeah.
temperature fluctuations, they really cause a lot of problems, and even the skin problems and all. So rather than that, they should be adapted to the temperature and the natural ways of cooling is more important. So generally, I advise them to have a normal bath. There is no need to second time or third time use the soaps and detergents. Rather than that, just you have a normal water bath so that will wash away the sweat and just pat dry. Don't dry up the skin also. Don't rub the skin because it has already become sensitive. So just pat dry that way. So it helps. Chandra sir, will you like to add anything like how to treat these persons with heat cramps?
See, Goel sir has already told who are the person who are exposed to heat cramps. One of the common example I would like to give, nowadays we are playing IPL and you might see many players do develop heat cramps. Why does it happen? Most of the time when you replenish fluid with water and adequate electrolyte is not replaced, so there is some electrolyte imbalance. Most often hyponatremia leads to heat cramp. So if heat cramp has to be avoided, replenishment of fluid should be done with adequate electrolyte also. I would say, ORS solution, or many examples have been told that putting salt on the
Tender coconut water.
lemon and then sucking and then taking water. So what it is that when a heat cramps develop, adequate electrolyte should also go. Fluid replenishment should not be restricted to plain water. So at times you may give salt in the water, or salt capsules may also be given. So you replenish the fluid, and when a person is at times, because of heat exhaustion, person may have nausea, vomiting, and he may not be able to tolerate orally, then in those cases, I mean, IV fluid, IV isotonic fluid, or if there is a hyponatremia, maybe hypertonic fluids may have to be given. So this is the way. The target is to rehydrate so that adequate volume is raised and to replenish the electrolytes which has been lost. So once your electrolyte becomes normal, these heat cramps can be appropriately managed. Thank you.
That is absolutely right. In fact, especially in children, IV fluids is a must once they are going towards the heat stress or the heat stroke. Otherwise, it will not be possible to save them. So apart from that, he mentioned about the electrolytes. I would like to say that adding the jaggery and the lemon and making panuka, or, this is excellent because the jaggery contains the fructose and then it contains iron and selenium and all trace elements as well as the electrolytes. And that's how we know salt, jaggery, lemon in water. That is excellent, apart from the tender coconut water. And it is so important to maintain. And cramps are much more among the diabetics and hypertensives. They get more dehydrated and they get more heat stress compared to the normal individuals. So that's how I feel I'm blessed that I never had cramps. Otherwise, you must see that they are so much painful. And especially when the activity is more, the lactic acid production is more. On top of that, when they have the electrolyte imbalance, it's going to be worse among the players.
Thank you, ma'am.
Many
Yes,
times
yes.
people having hypertension and diabetes are on certain medications,
Yes.
particularly some diuretics. They also cause certain
Absolutely,
electrolyte imbalance,
absolutely.
and that's why they are more exposed to that.
Correct, sir. Correct.
Thank you, sir. And as we already discussed about all these like players and all, and so many these people advertise about these drinks and all, but they're otherwise they harm it rather than benefiting the people. And the natural like electrolytes and the lemon juice, and even like when I recently went to the rural, I found they use a raw mango with jaggery and
Gulamba,
some
gulamba.
salt adding. So it is called
Gulamba.
pan. Yes, yes.
Gulamba.
Yes, ma'am. So in Maharashtra, they call it panna. And so that
Yes, we call
drink,
ampanna. Yeah.
yes, ampan. So that is given. So I think these people should not fall prey to these advertises of cold drinks and all. Rather than they cause a more osmotic imbalance, causing more harm than the benefit to that.
Even sir,
So,
desi gaane ka juice, which is available at every corner.
yes, sir. Yes, sir.
Water, so much of electrolyte, they put some salt into it and sugar, so it gives energy.
Correct.
So
That is the
yes,
best drink available all around the place.
so street juices are much better than the
Sir, in the lighter note, instead of going for the advertisement, they must listen to the discussions like this and understand what is the scientifically right thing rather than the paid advertisements. They take crores and then they give the advertisement for the wrong and the ill health. And I think such discussion should be like eye-opener to the common man as well as the doctors.
And already, like Madam was talking about some rashes during the heat. The same way, urticaria, angioedema also. I'm seeing a lot of cases every year. We get during the summer, most of the people, they talk about healthy season. But as an allergist, I get a lot of urticaria and angioedema patients. They increase a lot in our practices. And they have to be treated in a proper medications. Anybody wants to add about this rashes during the heat season?
Okay, so what I feel, one of the common rashes that we see is prickly heat, or miliaria, or a small dot would come on the body and something like that. That
Yes.
usually happens when proper functioning of the sweat gland is not occurring. So the sweat duct or eccrine ducts gets blocked, and when it gets blocked, at times it gets inflamed, and those rashes do come. And as you were telling, just wash with water rather than applying soap or rubbing it hard, because if you rub it hard, the skin is already sensitive, and those sweat glands may get damaged, and then they may get inflamed. So one of the common things that we usually see even in kids is rashes on the body when they are exposed to heat, and that usually occurs when there is some damage to the sweat glands or its its duct, so that the sweat does not come out properly, and some small swelling, small elevation or rashes do develop. So that is seen very commonly. The thing that we need to educate people about it, that you don't need to give antibiotic for this, you don't need to apply sophisticated or many brand creams on that, what it is called, heat ka dushman aisa karke ad aata hai na, Nycil powder or something like that. So cooling the body, these things are not going to help you. Just wash it with plain water, and usually these rashes go away in 2 to 3 days itself. Once your body cooling mechanism becomes effective, or your sweat gland or the blockage of the sweat gland is not there. So there is no fun in using all those fancy advertisement to treat your prickly heat. Just abide by the basic physiology of the body, clean your body adequately, and these rashes would subside itself in couple of days. That is what I wanted to add. Thank you, sir.
Yeah, Dr. Chandra told, don't go for the fancy things. I would like to say that go for your grandmother's method. Instead of soap, use the chanak or what to say, besan
Besan.
atta.
Besan
And that is
atta,
absolutely clean skin. You'll have very beautiful skin. And
dahi
apart
besan.
from that, chandan can be applied. That is, it is smells good, and as well as cooling effect is there without blocking the pores. So I think the old is gold has to be remembered by everyone.
If I talk about medication, I mean, when you told Chandan, it will become cold. Calamine is something, it is said that you can apply.
Yeah, calamine,
Yeah.
I mean, calamine
Yeah,
lotion.
calamine can be applied.
Yes, sir.
Yes, thank you. Thanks a lot. Only as a pediatric allergy specialist also, nowadays it has been found that some of the people, the food allergy is also increasing and the cutaneous sensitivity can be there. So very few people are there, very few children, they can get a sensitization because of some of the lentil powders and all. So there they have to be a little bit careful. Otherwise, most of the people, the chandan and all, they tolerate very well. And even like we see a lot of patients with the fungal infections also because of the sweat in the inguinal region, axillary region. So there specifically, suppose if they are infected eczema or something, then with the expert doctor's advice, they should use the specific creams or powders and all, rather than going for the advertised one because they have steroids into that creams and all, and they cause immediate relief, but long-term wise, they damage the skin. The barrier is lost also. So as we already discussed about all of us, the people should go to the expert doctor and take a advice than the advertised one. Any medications like Chandra sir said about some of the medicines, they can cause a dehydration and all, and they can aggravate these heat-related illnesses. So any specific medications besides this dehydration, like or laxatives? Sorry,
the diuretics are the commonest, sir. It's a diuretics which cause the loss of electrolytes.
Yes.
Apart from that, any drug which would compromise the function of the sweat gland. So anticholinergics, certain antipsychotic drugs, antidepressant. At times, amphetamine are the drug which causes increased heat production. So these are the drugs, which would compromise the thermoregulatory function, either increase the heat production or decrease the sweating or heat loss. So these are the drugs which can be responsible for increasing heat-related illnesses.
Thank you, sir. So Goel sir, like, what should a person do if he works in a hot environment? He can't avoid that thing.
Yes, I think we discussed this point.
Yes.
The most important thing is clothing. So they should wear clothing which are preferably cotton, thick cotton, which will absorb more sweat and allow the body temperature to be cooled down. And if as much as possible, the working place should have a good ventilation, so that heat is taken away by the ventilated area. It can be air cooled or air conditioning, nothing like that. Drink a lot of water intermittently to hydrate yourself. If you are feeling your tongue is getting dry, it means you are dehydrated. The other thing is, as you mentioned, I think multiple times, that drinking fluid with electrolyte, which could be electrolyte powder, it could be jaggery, it could be fruit juice, adding a common salt and a pinch of khane ka soda jo hota hai. So that will add to the electrolyte in this. So my home remedy for making ORS is take 1 glass of water, add 2 spoons of sugar, add a pinch of salt as much to the taste, and add a pinch of khane ka soda. So that will make a perfect electrolyte for anybody, which is home remedy, and it's available all the time. If you take care of that, and in spite of that, if you develop any features of fatigue, you get tachycardia or palpitation, it means you are getting affected. And then you can avoid the exposure for some time before coming to the same environment for working.
Thank you, sir. And even practically, like whatever we say, people are using so many air conditioning and all. So what they do is that they lower down so much temperature to 18, 16, and then suddenly, so rather than that, they should keep a temperature around 26 to 28 so that it should not be much cool and then again to the hot environment. So there should be the balance of the temperature if
Correct.
they're using the air conditioners
When
and
you
all.
are when you are traveling in the car, you put on the AC full, so you are in
Yes.
a cold environment, and now you are getting out in the market. So maybe you can bring down the temperature or stop air conditioning about 7 minutes before you get out of the car. So you acclimatize yourself to the temperature, and then you go to the. Otherwise, you from some 22 degrees centigrade, you go to 38 degrees or centigrade of outside temperature of 40 degrees centigrade. That is also a reason for creating problem.
Yes.
Yeah, as Dr. Goyal said, especially when your car is not in the shade and it is very hot, the first thing is to open the door and all the glasses and allow the collected air to go, and then put on your air conditioner, and
Yes.
that's the way to go about.
Yes, ma'am. Thank you, ma'am. So because of the already time is getting over, so
Yes.
we ask like when the patient should approach to the expert doctor. So Dr. Chandra sir.
See, whenever the ways, the simple rehydration processes, electrolyte, still problem is persisting. Core body temperature is more than 40. Unconsciousness is there. Blood pressure is low. Whenever you feel that some intervention has to be done, some intravenous fluids have to be done, or aggressive cooling has to be done, in all those cases, medical monitoring is needed. Let me tell you, in heat stroke, if a person is becoming unconsciousness, throbbing headache is there, probably home remedies are not going to work. Express cooling, either by sprinkling of water, fan, or immersion in the water, along with appropriate fluid and electrolyte balance, has to be administered to these people. Number one. Number two, when they are exposed to such a heat state, there are chances that some damage may occur to kidney, liver, and lung. So if you do have associated symptoms, these have to be taken. Then Goyal sir was telling that in different stages, different organs would get involved. So at times we need to do monitoring, because on day one, your blood investigations may be absolutely normal. But when damage starts, blood investigations may become abnormal on day 2 or day 3. So when there is severe heat-related illness causing heat stroke, compromise in the blood pressure, when there is some involvement of the CNS, when you get oliguria, your urine output has decreased. That is the first sign, I would say physiological sign of getting dehydrated and kidney getting involved. So when a person sees all these symptoms coming, they should meet the expert doctor so that a proper follow-up can be done for a couple of days, and if any complications do occur, they are attended timely. Thank you, sir.
Thank you, sir. Even I remember when I was a medical officer after MBBS, it was compulsory for us for 1 year. And there I found one of the old practitioner, one patient during this summer, he had been to him, and he had started only 10% dextrose as a IV fluid. So, like, what will you like to suggest, like, as a doctors also, as we discuss about how the electrolytes are so important. So, what IV fluids they should give these patients specifically?
So, when you talk about IV fluid, the first is that whatever is the hypovolemia, that has to be corrected. And I would say isotonic saline is the first fluid that should be given. Apart from that, if patient is in heat exhaustion or hyponatremia, we may have to give hypertonic saline. I would say adding, dextrose will be needed only if you really need to give some nutrition, or if the patient is having hypoglycemia or all. So the fluid of choice would be isotonic saline, and electrolytes, different electrolytes, depending upon the electrolyte abnormality, different electrolytes have to be added in those fluids. The target should be that adequate urination occurs. Maintaining blood pressure, pulse rate, these are things which has to be monitored. But if I have to monitor physiologically, the first thing that even I tell to my patients or even my ward attendants or nursing staff, that adequate hydration means if kidney is functional, adequate urine output will come. Even if you are rehydrating orally, urine output should come. So the amount of fluid will be depending on not only blood pressure monitoring but also rehydration as measured by or as expressed by adequate urine output. So these are the fluids or amount of the fluid that should be taken into consideration.
Thank you, sir. Even like as you said, some blood investigations we have to do, and depending on their hyponatremia, hypernatremia, what type of replacement or what restrictions should be given to the patient. Because otherwise, the hypernatremia, if it is more, it can damage, and if there is a significant hyponatremia, also it can cause a edema of the brain. I think Goel sir, you must be getting such patients. No, would you like to add anything?
No, I think we had a lot of talking
Discussions on. Yes.
Yeah,
I would like to add one more thing. Not
Yes.
only the urine output, the color of the urine is also equally important. If it is dark and high colored, that means it is concentrated. So until it becomes pale yellow, it has to be dehydration. And the ringer lactate can be added, and the orally, the tender coconut and other things can be given. So this is how we know in children especially, if there is a severe headache, if there is a syncopal attack, if there are convulsions, these are all absolutely severe, grave symptoms, and immediately the child has to be shifted to the hospital.
Thank you. Thanks a lot. Faraz, any questions or anything in the chat box? Faraz, are you there?
Yes, sir. Yeah, I have checked, sir. Like we have feedback from the audience,
Okay.
but I can't see one of the feedback from Dr. Manoj Toshniwal, and he's writing wonderful interactive session on MedTalks platform. And one feedback from Dr. Sonali, and she has written well taken topic and which is much needed for the awareness. Two feedback, sir.
That's so like I am really honored. Like I have so many good panelists and such a learned people, and that's why I think the questions are not there, because everybody has understood from basics to advances about the heat stroke. And I think definitely it will be useful to their practices also, all the doctors, and if any people have joined also into the community also. So thanks a lot, everyone.
In the lighter note,
Yes, ma'am.
in 2 times, you don't get the questions. When they have understood everything, no questions. When they have not understood anything, then also no questions.
No, ma'am. Today they have understood very well, because it was from, as I mentioned, it was a very simple language and everybody has understood. That's why their questions and all the organs also we have discussed today, and even like a common man also what he should practice, and as an expert also what they should give, all IV fluids, investigations, the renal damage, the brain and the skin, from so top to bottom we have discussed. So I think our delegates have understood everything. So thanks a lot, everyone.
Head, brain, kidney, everything, liver,
Yes,
stomach.
and
Thank you.
also.
It was really pleasure and nice learning for me also. Vijay Lakshmi ma'am, I pay my best regards to you. Goel sir, I pay my best regards to you. And Dr. Vijay, you have done really excellent. Thank you very much. Thank you, sir.
Thank you.
Thank you.
Thank
Thank
you.
you. Good day.
Have a great day.
It was a very wonderful and useful discussion. And I'm sure audience, especially the younger student, medical student, if they are listening to this, they can write a note in exam after this. So we have covered it.
And practically also in their practice, it will be really useful.
Long answer लिख सकते हैं.
They can write an essay also.
So it was a rare occasion and a pleasure for me to meet a pediatrician and a physician and a neurologist, Otherwise, we are always in only the pediatric cardiology. So it was a pleasure talking to you all and discussing. Thank you very much, each one of you. Namaskar.
And ma'am, you are coming to Delhi, as I told you.
Ma'am, Lucknow कब आ रही हैं आप?
December.
मुझे लगा आप भी आएंगे कुछ गर्मी से. Okay, ma'am. I will be, it will be great if I could meet you when you are in Lucknow.
Sure. Thank you.
Thank you.
Thank you
Good
so
day.
much, everyone. And it was a wonderful session from your end. Like, as we know that people are more prone to social media and try to become their own doctor. But from this medium, like all the great knowledge will be shared from expert like you, sir, and it will be very much beneficial in this season of heat summer. Thank you once again for making this session wonderful. Thank you, sir. Thank you, ma'am. We are closing for today.
Thank